Hi, good afternoon, everyone, and welcome to WAN-IFRA and Roche Masterclass on Women's Health Preventing Care Reporting. I'm Jen Teo, overseeing the Training and Special Project at Asia Pacific WAN-IFRA. Thanks for Roche for inviting us to collaborate once again to organize this masterclass. We hope this session will help you understand the latest science on testing on gynecology cancers and other conditions that respond well to early diagnosis. As well as identify opportunity to use a solution journalism approach in reporting women's health preventive care. We have two distinguished speakers and trainers to lead us on this topic today. Professor Woo Yin Ling, a consultant, gynecology and oncologist at the Universiti Malaya in Malaysia. Dr. Woo is recognized expert in HPV vaccination and a member of the APEC Cervical Cancer Working Group. She is also the founder of Roche Foundation, a non-profit organization that dedicates to making cervical cancer prevention accessible and affordable to the underprivileged. Our lead trainer is Corrine Podger, who is the director of the digital skills agency based in Australia. Corinne has worked in the media sector for more than 30 years and is an accredited trainer with BBC Media Action, Thomson Reuters Foundation, and the Solution Journalism Network. She has proved to be an expert trainer and educator across many disciplines of journalism. So without further ado, I'm pleased to invite Corinne to kickstart our first segment. Over to you, Corinne.
Thank you so much, Jen, and thanks everyone for being here. If you are happy to put your cameras on, it's always lovely to see beautiful faces joining us from all over the place. Obviously, I know not everyone's Wi-Fi supports that, but if you are happy to pop a camera on, it's always nice. Okay, so I'm just going to briefly share my screen just to set the stage for the Q&A that's coming up with Prof. Woo. But as I put into the chat, this is your chance to ask anything and everything that you would like to know as a journalist about how to improve the way specifically that we report on cervical cancer and HPV. It's a field that's changed a lot, obviously, and so we might not always know what the latest is and how we can improve our reporting. So have a think about that. So just briefly. All right, so we're hoping that by the end of this masterclass, we will have covered off these learning outcomes. So you'll have a better understanding of terminology and approaches to women's preventive care, to understand some of the barriers that can block women, particularly in the Asia Pacific, from seeking early diagnosis of preventable illness. Also to think about reporting sensitively and appropriately on women's health. And we will, in the second half of this class, we'll look at some approaches around reporting from a solutions journalism perspective. As Jen mentioned, I recently became an accredited Solutions Journalism Network trainer, and I think it's a really interesting way of digging into issues that perhaps otherwise might put people off because it's bad news fatigue, or there's just no information that they can use. Solutions journalism helps us think about that differently. And then hopefully we'll close off the class, and those of you who can stay all the way to the end will have some breakout rooms to begin to think about how would we use solutions journalism to tell some of the stories that we want. So the format will be a Q&A, then a breakout room just to start thinking about story angles. And then we'll come back and look at the overview of solutions journalism. And then I have some group exercises that we can do together. So that's the format. Now I'm going to stop my sharing and open my screen up and go straight into the Q&A with Prof. Woo, in fact. So thanks so much for agreeing to do this. I know you're incredibly busy with all of the work that you're doing, Prof. Woo. So thank you so much for being here today. It's wonderful.
Thank you for having me, Corinne, and the team.
So the first and most obvious question is, what do journalists and editors need to know about cervical cancer?
Well, I am absolutely delighted and excited and very keen to let everyone here know that cervical cancer has now been classified as the first cancer in human history that we can eliminate. This means that in your lifetime, Corinne, and my lifetime, WHO has said that, the World Health Organization has said that if we carry out certain strategic plans within our country, within our communities, we can reach the elimination of cervical cancer, not in 20 years, but by 2030, which is just 8 years down the line. And Australia has already declared we're going to be the first country to do this. So we're looking forward to this, and this excitement may not be felt by everyone because of how COVID has just overtaken everything. But I think this is a story that's worth highlighting. The big C, we can now eliminate.
Let's dig into that just for a moment and think about the methodology for achieving that. So it's a huge claim. How? What's the how? How does that happen?
Right. To know the how, we must figure out, or I would like to share with everyone how we've come to the solutions. In 1982, the Nobel Prize winner Harold Zurhausen made the link between a high-risk human papilloma virus, what we call HPV, to the development of cervical cancer. This was in 1982, not too long ago. So he, together with many scientists, work and have come up with this conclusion. If you get cervical cancer, HPV is a necessary cause. Well, of course, there are other factors that may contribute to it, say a low immune system, certain genetic factors, but you still need to have high-risk HPV. Now, since we know what causes cervical cancer, this common infection, means that if we can prevent it, or if we can detect it from causing any harm to the cervix, we can then prevent the cancer. So today, this very day, we already have the tools to prevent the majority of high-risk HPV infection through vaccines. So we now have very effective HPV vaccines which are given globally throughout the world. There have been more than 800 million of these vaccines given already. And the second thing is cervical screening. And of course, the third big strategic step that we all have to take is that if the screens are positive, women need to be treated appropriately. So vaccines, screening, and treatment.
Wonderful. Thank you so much. Now, I am going to encourage everybody. There are no wrong questions. In sessions like this, there are no dumb questions. There are no wrong questions. So pop anything, everything that you would like. Obviously, this is it's a public forum, but we're all caring and kind to each other, and we really want to help each other understand this very well. And with that in mind, I'm going to ask something that would probably seem really basic, but tell us a bit more about human papilloma virus. What is HPV?
So this human papilloma virus is a ubiquitous virus. It's been here with us since the start of time. There are 200 different types of human papilloma virus, but only 14 are associated with the risk of developing cancer. Now, two of these types, type 16 and 18, then account for 70% of the cancers, and then 7 of them that account for another 90% of cervical cancer. Now, human papilloma virus is common in the sense that 80 to 90% of men and women at some point in their lives will acquire the virus. Most of the time, it's acquired through sexual activity. Now, I want to sort of bring the concept of humans coexisting with viruses as part and parcel of our lives. So most of us would be familiar with, say, chickenpox. We've all had chickenpox when we were young, and it lives with us in our system. And when we are weak, then you get the sort of reactivation in the form of shingles. So we're familiar with that story. The second type of virus we coexist with is herpes virus. And when we get stressed, we get cold sores. So that's another example of a virus. So with HPV, human papilloma virus, most of us would have acquired it, and most of us would keep it under control in our bodies. Now, in individuals with cervix, they have the virus there most of the time, but when their immune system is weak or a contribution of factors that we may not fully understand, those that we understand are low immunity, exposure to cigarette smoke, those would increase the risk of what we call persistent infection. And when you have persistent infection over many years, that leads to the development of changes in the cervix and development of cancer many years down the line, which gives us a window to detect and to treat effectively.
So this might now another potentially dumb question, but if
no questions are dumb. Remember, you said that.
I did say that. I guess I'm kind of setting myself up as a straw woman, a straw man, to encourage folks to put questions in the chat box. But so how does the vaccine work? Does it prevent infection? Does it respond to the virus, given that many of us carry it already? Let's talk a little bit about that.
Sure. So in the vaccine is actually a prevention vaccine, although in a small population later on, you can use it to help with therapeutics. But let's take the public health measure. HPV vaccines have been around since 2006, and many countries have adopted it in their school programs or in their health system, where young adolescents, 13-year-olds, 12-year-olds are given these vaccines as part of the government's health program. These vaccines are assumed to be given before they are an individual's first sexual debut, which will then reduce the risk significantly of them ever acquiring the virus. Now, these vaccines, no vaccines are 100% effective, but they're more than 95% effective in preventing the acquisition and of high-risk HPVs, which is covered by the vaccines. So, for example, in Australia, it's been given since 2007. And in many countries, the girls are given initially, and in some countries, the boys are also given for additional benefits.
So for someone who has the virus in their system, for whatever reason, what can be done to look after them, including in a preventive way, obviously?
Excellent question, Corinne. This is where your communication as a journalist is extremely important. We've already highlighted or alluded to the fact that HPV is a very common infection. One of the things that we have to dispel is that it's a sexually acquired or sexually transmitted disease. Because it's a common infection, it's not a disease. So there's no contact tracing. You don't have to, get your partner treated. It's a common infection. So in terms of prevention, there's really not much sort of intervention you have to make to prevent yourself from acquiring the virus. Let's assume it's part and parcel of life. Now, the question comes about is if you have acquired the infection and you are not able to clear it and you want to screen for issues. Now, how do we do that? This is where screening comes about. The biggest major shift or paradigm shift in screening is the change from the conventional pap smear to HPV testing, a molecular test, a PCR test. So many countries are now switching or have switched from pap smears to HPV testing. So you're looking right at the temporal cause, looking for the cause of abnormal cells. And that's a form of prevention. You look whether the virus is there, and then you investigate whether it's been there long enough to cause a problem. And third, to treat it.
We do have a question in the chat. So friends, the way that I like to do Q&As is if there's a question in the chat, I go to that straight away. Mara Magni has asked, how widespread are HPV national screening programs in the Asia Pacific region and how effective are they?
Yeah, so Australia once again was the first country to switch over completely from a pap smear program to HPV testing in 2017. So, and it's done every 5 years. So it's not like the traditional pap smear where you have to do it every year or every 3 years. So the first cycle has already happened. And I believe this year or next year will be the next cycle. So Australia has changed over to HPV testing. Malaysia is in the process of doing so. So we're about to launch what we call a 5-year plan of action, changing over from pap smears to HPV testing. Now think about it, right? And Thailand is also doing the same. Now, if you think about it from a perspective of as a woman individually, this is a big thing you're asking us to do. You're asking us to change from pap smears to a PCR test. What's this about, you know? So obviously,
I'm actually curious. I'd love.
Change.
I know that there's something that you can show us in a little while because I'm interested in understanding this. But let's come back to this question. So you're talking about Malaysia, Thailand, and a couple of other countries.
Yes.
But perhaps what are we seeing in the Pacific Islands, and also how effective are these programs?
You see, we have to ask what programs were there before. You can only swap over if you've had one of those programs that have been effective. And in Asia Pacific, we are from what we call the lower middle income setting for many, many of us. And in these countries, we never had an organized pap smear program. That's why we carry the burden of cervical cancer in our parts of the world. So we don't have an existing strong pap smear program, and now something new has come about. And this is where the thinking of not even, I use mobile phone as an example. So not many places have the infrastructure of phone lines, and mobile phones came about, and now everyone is using mobile phones. And this is the concept we hope that Asia Pacific would adopt. We could not have organized pap smear programs because of all the barriers which we can share. And now we can have a quick PCR test where every woman just needs as few as 2 tests in their lifetime. 2 tests, Corinne, 2 tests, everybody. Not every year, just 2 tests in your lifetime.
I might just ask if you could just explain for those of us who are unfamiliar, you keep saying PCR test for cervical cancer. And I think, you know, we're all now a lot more familiar with the concept of a PCR thanks to COVID, but could you describe this for us? So I mean, obviously, those of us who've had a pap smear are familiar with that procedure, but what's this new procedure? Talk us through it.
Yeah. If you will forgive me, I will explain the pap smear program first so that we have the background, because the change is quite huge, and I think even many doctors are not aware of. Now, for those who've never had a pap smear, this is a speculum. I'm going to keep this in my drawer as it's going to be an archaic piece of equipment, I hope, in the future. Now, what women need to go through when they are of a eligible age for pap smear is that they need to have a pelvic examination. And now this requires a woman to lie down and to have this instrument inserted for a healthcare professional to take some cells from the cervix every 1 to 3 years. That averages out to about 15 times in your lifetime. So a woman needs to go through this 15 times in their lifetime when they're not even ill. We're talking about a screening test. So you can understand why most women, including myself, are so hesitant or may not even want to go for a screening test that's effective. Now, since science have shown us that HPV is the cause of cervical cancer, and we now have the technology to screen using PCR, you can now have something like this, a swab which now most women are familiar with. And this swab can be inserted in the vagina, either by the woman herself or by her healthcare professional, to take a sample for PCR test. And this will then be run in the machines, the exact same machines that do COVID testing, that do HPV, hepatitis testing, that do HIV testing, the same machines that do PCR testing. You can do HPV testing for the 14 HPV subtypes that cause cervical cancer. And because we are now looking at the cause rather than the abnormal cells, we are going back right temporally to the beginning of time. And so we have a period of time where we can intervene. Now, what does this mean? This means that if you do not carry HPV, it is very unlikely that you'll get cervical cancer in the next 5 to 10 years. So no screening for 5 to 10 years if you are HPV negative. That's a lot of information, Corinne. I'm sorry.
It is. No, it's extraordinary. And I'm wondering if I should make an admission. So one of the things, and I think that it's an important admission, I think. So one of the things that we've talked about is that doctors may not even be aware that things are changing because it's being rolled out slowly, but also women may not be aware that it's being rolled out slowly. So the last time I went for a pap smear, because I detest them so much, is before these were rolled out in Australia. And I was so terribly excited to see that there's now a little swab as opposed to a massive, great big speculum. And it's made me think, gosh, I might actually go and get tested, just to make sure I don't have cervical cancer. So that's exciting and mind-blowing. Let's I just want to quickly cover off this idea of 2 tests in a lifetime. So how does that work math-wise? What does that mean?
Right. Remember when we first started this discussion that how by 2030, we should be able to eliminate cervical cancer. We have the tools which we talked about, let's recall, which is HPV vaccines, screening, and treatment. Now, what World Health Organization declared this strategy that's not too long ago, they came up with what we call a protocol or procedure or policy, whatever you call it. There are 3 things that each country has to do to achieve this by 2030, the elimination. This is it. 70% of your girls or adolescents should be vaccinated against HPV by 2030. Second thing is, 90% of your girls should be vaccinated. Second thing is 70% of eligible women need to have 2 HPV tests in their lifetime to detect the risk of cervical cancer. They no longer say 2 pap smears. They no longer say 5 pap smears. They are saying as few as 2 HPV tests at the age of 35 and 45, and that will significantly reduce your risk. The third component is, if you've got a positive test, anyone with a positive test should be directed to the appropriate treatment, which means the third goal is 90% of those with an abnormal screen should be linked, should be tied into treatment. Now, a screening test intrinsically, no matter how good it is, will have no value at all if we do not link them to treatment if it's positive. So 3 things: vaccination for girls, screening by HPV test, and third thing is to treat and to follow up if it's abnormal.
I have so many questions. One quick question that I just want to drop in is, you did mention earlier that sometimes there are programs to vaccinate boys. Is that worth consideration? Does it protect boys against transmitting the virus to their partners later in life?
Now, more there are lots of reasons why we vaccinate boys. I don't know whether we have time to cover. There are 20 countries now that vaccinate boys as part of an equity or equitable type program. There are other cancers that are also due to HPV, tonsillar cancers, anal cancer, peanut. They're small in terms of public health issues. And the third thing, by vaccinating boys, you really create herd immunity. Now, the clever people who do modeling, they say that to achieve good coverage, good prevention, you need 90% of your girls vaccinated. Now, if you do boys and girls, then if, let's say, there are interruptions, say, for example, COVID, by vaccinating 60% of the population, boys and girls, so you develop a resilience in your vaccination program, then you'll still get some level of protection. So that's why some countries have adopted this approach of vaccinating boys and girls for additional benefit and to build in the resilience of a program to benefit the girls in terms of developing herd immunity.
That's a really interesting story angle, I think, is what's going on in my country for the people who are on the call with regard to who's being vaccinated, what's the story with rollouts of PCR testing versus pap smears, and also how well aware are doctors and medics of the new technology. Is it available in my town or city? Is my health worker aware of it, and so on? So there's lots of potential coverage there. I do want to move on to one of the big questions for this session, which is the social and cultural barriers that prevent women from seeking early diagnosis. So
Corinne, can I touch on something which is really important before we touch this, which is a huge factor? One of the questions I get asked very often, besides do I vaccinate my son and my daughter, how often do I screen? So as a physician, I always answer the question either to an individual or as a policy. So do I answer it to an individual who wants to act or take action for their loved ones, their immediate loved ones, or do I speak to a government to address policy as a public health issue? Because then the factors of cost effectiveness comes in. So people ask me, oh, how often do I need to do HPV testing? You're saying that WHO says twice in a lifetime is sufficient, but a country like Australia is doing it every 5 years. So what's the right answer? The right answer is what is most suitable or appropriate for your for your setting, for your country. What are the economics? What are the competing demands? But we know as few as 2 in a lifetime is enough. But if the resources are high, it's 5 every 5 years. And that's the same with vaccines. If a country does not have the resources to vaccinate all their boys, but if an individual wants to vaccinate their son, that's possible. So in terms of reporting and advice, there's always reporting in terms of an individual's story or a country's story. I hope that makes sense.
No, it absolutely does. Now, let's come on to this issue of barriers. So social and cultural barriers around seeking testing for HPV and also screening for changes in the cervix. What are some of the issues? I mean, I think most of us can guess quite a few of the issues, but what are some of the things that perhaps stop women from getting early diagnosis, and what can we do about that as journalists?
Sure. I'm not going to generalize for everyone because the social cultural barriers are different for every setting. And I'm not even going to generalize for everyone in Malaysia because the cultural setting in the rural area and the urban areas are different. So I'm just going to give you a picture, give you as an example of the urban area in Kuala Lumpur. When we talk about prevention, you're essentially trying to persuade a woman who is well with no issues with regards to her health, while she has issues with her job, her children, her finances, perhaps her marriage. You're asking her to take time from dealing with all these issues and go wait at the doctor's office for hours and opportunity cost that's lost to have a test that's embarrassing and invasive for prevention, for a problem which I don't perceive that I have. So and that's the same with mammogram. I'm well, you're asking me to go compress my boobs every year. You see, so we have to ask the question, what are we asking women to do in terms of taking preventative steps? Then there's diabetes, there's heart disease, there's cervix, there's mammogram. My goodness, I'm asked to do all these things. So one of the solutions, I think, is integrating all this into perhaps one visit, and then integrating evidence-based tests that will make a difference. Third thing is improving the processes in which we can help women save time. If you can register on a mobile phone, rather than waiting for hours, waiting for someone to write it on paper, what's your identification card number? Now, how do I spell your name, which has 50 letters in it? If I could prepare all that, if I can scan it in, and then we can do it all at one go, I think women may come forward more often. Then, of course, there's the cost, then there's access, lots of issues.
I might maybe if we can move just for the last few minutes of this Q&A, just I guess to really drill into this specific question around not what's needed from policymakers and the health profession, because journalists can't make much of a difference to that, but more, what is the narrative that you would like to see changed such that women are more likely to seek screening and treatment and testing, screening, treatment, vaccination? What is the narrative that you would like to see shift?
I think as women, we often don't look at ourselves. We are actually carers for lots of people, individuals. We're carers for children. We're carers for our parents. We are the sandwich generation that cares for everyone. And I think what I want to say, when we've heard, when cancer strikes, so much is taken away, so much is at risk. And if you have the ability to just undergo a test twice in your lifetime to prevent cervical cancer, why not just take that time to just do that test? Because it is the second most common female cancer in Asia Pacific, which can be now eliminated.
And what would you like to see from journalists?
I like journalists to tell that story. Mm-hmm. I like journalists to perhaps go speak to someone who has had cervical cancer and listen to that story, and then see, now that I've told you how easy the solutions are, if you can then see the issues or understand the issues. I'm sure many journalists here have families and friends who've been affected by cancer. So if you translate that into the simple preventative strategy and get that message out, that would be very effective.
We have one question which I'll jump into, and then we'll sort of start to wrap up and move into some breakout rooms for you guys to start thinking about some story ideas and angles. How important is fact-checking in encouraging HPV vaccination? That's from Alphonsus Adiputra.
Where do we get the facts from now? That's very important, which we don't have time. But I think with
we do
HPV,
have time. We can make time.
With HPV vaccination is a bit easier. And I think the fact that it's for Malaysians, it's endorsed in schools. It had the support of religious leaders, education ministry, and from the Ministry of Health. This strong message that it's effective, it's used, it's safe, has been very good. And there are facts. So fact like if you use HPV, if you're vaccinated against HPV, you have removed 90% of risk of developing cancer, and you don't need boosters. It is safe. More than millions of doses are given globally. It's not experimental anymore. So it'll be interesting to see, Alphonsus, what has happened to the uptake of HPV vaccine now that there has been so much talk about COVID vaccines. People are now becoming, or they think they've become experts in vaccines. So in the past, the issue of HPV vaccination has not been so difficult because we are used to tuberculosis vaccines. We accept childhood vaccination a bit easier. So there are fact checkers available. There's lots of information around.
Excellent. And just to let folks on the call know, we've put together some resources which include reliable links and sources of information. So those will be circulated to you by Jen at the end of this session. So listen, guys, I'm just going to wrap this up. We have the great privilege of Prof. Woo staying with us on the call while you guys do your breakout rooms so that she can listen to and perhaps give some feedback on your story suggestions. So without further ado, I'm just going to take a quick look at my slides without actually moving to them because it's quicker, and putting this in the chat box. So Jen's going to set you guys up with some breakout rooms, and your task, should you choose to accept it, is to think about what you've just heard in the past 20-30 minutes and develop some ideas for some stories. And then we'll have about 20 minutes of reporting back. If we've got 4 groups, I'll do the math, don't worry, we'll have about 6 minutes per group. So please nominate a spokesperson for when you come back and just hop into your breakout rooms. Welcome back. So folks, we have a bit of time, and I just can't emphasize how lucky we are that we have literally one of the leading experts on gynecological cancer on the call. So there's such a great opportunity to have someone whose expertise sits across the story angles that you'll have hopefully been discussing. So could we start off with the first group? Do you know who your spokesperson is? And then I might actually ask a few of you individually. So just be prepared for that. So I might say, hey, Jen, for instance, what was something else that you heard in your room? And you might put your mic on and tell me. So who's our rapporteur for group 1?
Okay, hello, I'm Joanne I'm from the Philippines.
Thanks, Joanne. Go ahead.
Yeah, I wasn't able to get Hideas and the other one. I forgot the name. I'm sorry, because I think my connection is a little slow. But so far, what we have discussed was like, for example, what Ralph said. Since he's also from the Philippines, the accessibility of the vaccines, if it is whether it is a government subsidy or do people have to pay for it, I think is what Ralph's story idea is about. And then on my end, discussing about the HPV itself, the vaccine availability, screening, and the social and cultural barriers. Here, I believe is a little, since the topic is a little taboo. And then the other one, I forgot her name. I'm sorry. I think she said something about having to interview someone with a first-hand experience. I think it's a good idea also. There. That's for group 1. Thank you.
Thank you. And does anyone else from group 1 want to add to what Joanne just mentioned? So there was Mylene, Putri, Ralph, Rashini, and Hidayah.
Hi, I'm Hidayah.
Hey, Hidayah, go for it.
Okay, so I think first I would really look at the vaccination rate in the country. So for me, it's Singapore, and kind of detail the risks that the group that's not vaccinated is facing. Because from what I understand, there is a national vaccination drive for women of a certain age, mostly girls, and they can get vaccinated for free. But for women in the older groups, in the 30s and 40s, just from the sentiment on the ground, not everybody has been vaccinated, maybe because they didn't know when they were younger that they were supposed to be vaccinated. And so that's part 1, basically just look at the statistics, what the vaccination rate is like and what experts think about this vaccination rate. Is it healthy, or what is the target goal for Singapore? And then secondly, for those who have not been vaccinated, what's next? is it too late to get vaccinated? If it is too late, then what are the things that we can do preventively?
I'm just capturing your points in the chat. Vaccinated, what do you do? Question mark. And in fact, that's the case for people like me. So when the vaccination was rolled out, I was already in my late 30s, I think. So I wasn't eligible for it. And so you sort of feel like, oh, well, what is there for me? So
Screening.
Screening, exactly. So Prof. Woo, you can see in the chat there some of the points.
Yeah, I picked up a few points. I want to
perhaps give some feedback.
Yeah, I think Joanne, you and your colleagues in Philippines can start something already. Now, sometimes when the public shouts loud enough and there's attention on something that's already happening globally, then your community, your citizens will ask, why aren't we getting this? So the question is, if you're not getting HPV vaccines that are given in so many countries, if you wrote a piece, our neighbors in Thailand, our neighbors in Malaysia, and that young people are already getting HPV vaccines, why are we not vaccinated? Then you can create a conversation there. The second thing is a very big thing you brought up is taboo. Why is there a taboo on a common infection? So there must be some myths around it. So a piece like smashing the myths around HPV, or when you interview an individual, or the individual has been so ashamed, they want to be anonymous, they've had cervical cancer, but they don't want to be known in the public, so they'll only speak to you if they're named anonymously. Question is why that's the case. So you bring up all these examples of taboo, of shame, and then you address why it shouldn't be the case, and you bring in the scientific papers, understanding now on what HPV is like. I think that is quite a few pieces you can tackle already in the Philippines.
We have a couple more minutes. Does anyone else from Group 1 want to add anything? So maybe Putri or Alphonsus or Ralph?
I guess I'll volunteer.
Thank you.
Right. Yeah, because I guess on it being a taboo issue, how can, I guess from a man's perspective, like how can we understand more about HPV vaccines? And because I understand that while it is predominantly an issue for women, we'd also want to be part of the conversation. So how can we be part of the conversation? That could be something that we can also explore.
Yeah, Ralph, that's really good. So there's even a group, I can't remember the group, HPV in men or something. There's actually an advocacy group that's set up by men. How come you're leaving us out of this conversation and discussion? We want the vaccines too. I think you can bring in the facts of how common HPV infection is in men. So there are papers, scientific papers in general. We're saying that, if you screen 100 men today, 50% of them will have HPV picked up. So it's a common thing. So if it's a common infection for men, it's a common infection for women, why don't we just vaccinate everyone with very effective vaccines that are here now, so that they won't be an issue for them as they grow up? And it will benefit all. So it's not specifically for men who have sex with men, which it's of course more common, but for other men who may have anal cancers, tonsillar cancers, other cancers, there are reasons why these vaccines may be beneficial to society at large. And it is a small and cost-effective investment just for cervical cancer. But can you imagine the added benefits if you vaccinate boys as well. Then you can bring in the papers and the arguments that are used in other countries of why boys should be included.
Thank you so much, Prof. Woo. I hope that's useful. And Ralph, I've just quickly looked up gender neutral HPV, and I found this link to a story in Global Citizen, actually, which is how someone lobbied for change around gender neutral vaccination in Britain, which is interesting. Let's move on, if we can, to group 2. So that's Alphonsus, Alifa, Joyce, Marshall, Sharon, and I think that's everybody. Who would like to go first? I think Marshall, I think Jen said you might be the spokesperson. Are you comfortable with that? Is that okay?
I'm okay. Actually,
Hello.
we didn't assign anyone. I just, yeah. Anyways, we were talking, exchanging ideas, and I was able to take down 3 points from my group mates. So the first one is that, since because of the COVID-19, more people right now are conscious in terms of when we say vaccination and all. So many people are receptive to vaccines. So it's nice to explore the impact of COVID-19 to other diseases, of course, including HPV. Okay, that's my other spokesperson. So the second point is, of course, the sustainability of the government in providing these kinds of vaccines. Although there's that perception that vaccines are not safe, how could the government sustain this? Of course, it would involve regular checkup, and yeah. So the last part, actually, it's kind of related to what have Group 1 pointed out earlier, the taboo. So my teammate from Indonesia has mentioned, and actually I agree with him, that there are still women there in his country that are subjected to sexual taboo. So in terms of these kinds of topics, he said that it's nice to fact check. So this is kind of related to the first group, what they have pointed out. So I guess we think alike, probably. So so that's what we came up, and I really do hope some of my group mates can add something. Thank you.
Thanks so much, Marshall. Hidayah, we'll come to your question in a second. Prof, Woo, did you want to respond to any of what Marshall said? And then we'll see if anyone else in group 2 wants to contribute.
I've been very naughty, Corinne, because you are in your next session, you will be talking to everyone how to sort of read a paper, a scientific paper. And I've just been so naughty, I've thrown in a PubMed reference here. Now, this paper is essentially the title of the paper. It says that the impact of HPV vaccination and cervical screening on cervical cancer elimination, a comparative model analysis of 78 low and middle income countries. Now, what this paper is saying that in the country where you and I in, they've already done the costing. So in terms of investment, and the return of investment, vaccination and screening saves lives. So if you were to write a piece and if they say it's cost and cost and cost, you can use a paper like this to say that if you invest, you will save more and then you will see visible return of investment in your country. So that's the issue on cost, but in a scientific paper. So
thank you. Oh, keep going. Yep.
Now I'm going to touch on, is it stigma or which?
Yes, Hidayah's question. And just in case anyone's having trouble reading the chat, it says, what is your own personal experience with stigma surrounding HPV? Is it taboo because it's sexually transmitted? Perhaps because it sounds like HIV? Good questions.
it's a huge taboo, and that's something that I'm personally trying to address. I've spoken to media. If I'll find it later on. I'll put it in a local media. So when you talk traditionally, what are the risk factors of cervical cancer? When you ask doctors, when you ask medical students, the textbook answer for the longest time has been multiple sexual partners, the early debut of sexual activity, having sex at a young age, not using contraceptives. All these seem to be associated with certain behaviors. So there's always stigma around it. Now we have to move away from that. And the narrative I always use, when someone asks me what's the biggest risk factor of getting cervical cancer, number one biggest risk factor is not getting screened, not having your cervical screening test. And why do I not related to behavior, sexual behaviors? Because to me, it is not relevant as an intervention. You have all these risk factors, and those behaviors may be difficult to change, may be circumstantial. Let me ask you, if you talk about early sexual debut, you look at the statistics by UNFPA, up to 30% of young girls are forced into early marriages. Do they have choice about it? No, they don't. So don't tell someone who's been pushed to to early marriage, childhood marriage, that their circumstances. Corinne, you talk about sensitive reporting of women's issues. Many of these factors, the women do not have a choice in it. But the choice that they have is going for a screening test. So we have to move away from these risk factors to talk about choice that they have, which is screening. Very important narrative that we hope that we can address. So yes, it sounds like HIV, and we've done qualitative questionnaires on that. And many of those who have poor health literacy have associated, they think it's HIV. And this is something through education, through engagement, through your writings that we will hopefully dispel sooner rather than later.
Thank you so much, Prof. Woo. I'm capturing in the chat box just ideas, and I'm up to number 15. So hopefully this is helpful, friends. We have perhaps Alphonsus or Alifa or Joyce or Sharon. Did you want to contribute to what Marshall shared? Any other thoughts from your group?
Thanks,
Please
Marshall.
go ahead.
So the first one, I wanted to talk about, I guess, the effect of the COVID vaccine on public perception. I guess about the vaccine itself, people are more receptive to the idea, to the term like herd immunity or like vaccination itself. And also one more question. So in Singapore, the topic of PCR and screening itself, I mean, it's been more talked about. I mean, we understand the term PCR itself because of COVID. I'm just wondering, what do you think about like self-administered vaginal swabs at home that has been available also recently in Singapore on HPV testing? Like, are they as accurate perhaps? I mean, now that it's available online, but I guess for me, I'm not very sure. Is it as accurate as what just now Prof has mentioned on testing twice? Yeah.
So besides those questions, you will have more questions, and I think Corinne will later on show you where do you look for information, where do you look for scientific papers to back it up. So Sharon, I can tell you that many papers and studies and what we call meta-analysis, or many accumulated scientific evidence, have already shown that a self-swab, a swab that's done by the women themselves, when compared to a swab acquired by a doctor or physician, it is as accurate. Okay, it is as accurate as long as it's done on what we call the PCR machine is validated. Now, that's also an easier conversation to have now. You know how you have on social media the different types of RTK tests, antigen tests, nasal, saliva, and how they're saying some tests are accurate, some are not. That's the same with HPV tests. And I think that's quite important to appreciate. Not all tests are the same. So some tests are approved and validated and some are not. So when women do self-test, and you have to a certain extent rely on your government or your enforcement agencies to ensure that only the right tests are marketed. So in countries where there's no enforcement, there is a little bit of danger of tests that are not validated to come into the market, and that's where the danger comes in. Same like supplements, right? You can get anything from Shopee or Lazada. And I think there will be a point in time where all this can be purchased and you're then worried whether you're getting it the right test and the right swabs. But in Singapore, yes, you can buy it from home and it's reliable.
Thank you for clarifying.
That's really interesting. I'm mindful we have to let you go in about 6 minutes. Let's just see if there was anyone else. So Joyce or Alifa or Alphonsus?
Hi everyone, Alifa here. Can I share a bit?
Please do.
Yeah. So, Prof, I just like to first of all, thanks Masha for sharing the point on sustainability. So I just like to follow up on that, Prof. So when we talk about sustainability or political will, as COVID has shown us, the information or knowledge continues to evolve, and this sometimes causes fatigue in the public, and that fuels skepticism or fake news. So how do you ensure that the policy or communication is consistent? Because the vaccine rate has shown, primer series it's high, and then booster dose we're struggling with that. So people are just tired in general, I suppose. Yeah.
That's a really, really good question, Alifa. Now, let me tell you the difference, first of all, between COVID and cervix cancer. The COVID is very much like similar to flu, where the virus evolves. So you get different subtypes evolving. You have the Omicron, you have the Delta. Now, with cervix cancer, the subtype of the virus that causes the cancer has remained the same. They don't mutate. They are the same structure. They look the same and they've never changed. Time has never seen a change in the cancer-causing HPV subtypes. So they're there. The vaccines have been shown to be effective, and now they're very effective vaccines, and they're the same. They are protein-based, they're not genetic, they're not like your mRNA where people have so much worry about. So they're protein vaccines, they don't cause infection. So it's very different types of vaccines, and it's a virus that doesn't change, and it's a virus that's associated with cancer development. And now what's interesting is you now have very good data from countries that have been using these vaccines for more than 10 years. So if you look at Sweden, if you look at Finland, all the countries that started using these vaccines in the early 2000s, they've now got data to show that the incidence of cancer have indeed dropped. They've also got data to show that it is safe. It's not associated with risk of Guillain-Barré syndrome, neurological symptoms. So it stood the test of time. Whereas with COVID, we still don't know where it's going. And when people ask, are these vaccines safe 20 years down the line? We don't have that information, but that's different for HPV because we have that data today.
I just want to clarify one thing. So if you have a vaccination against HPV, Prof. Woo, is it just one shot? It's the one shot, or is it more than one shot?
The one series. So children only need two doses.
Yep.
And there is now very strong evidence that they might only need one.
Excellent. I'm just putting this into the chat. So
Where-
there's our 20-second story idea. Well, how one simple jab can protect you from cervical cancer for life. Sorry, I didn't mean to interrupt you. Go ahead.
No, that's very good. I'm going to give you the announcement that was made last week by the UK.
Great. Just while you're doing that, I mean, when I was a kid, we all got lined up to get our rubella vaccinations when I was in the 7th grade. And I mean, it was obviously, this was well before social media. It was before the internet, you know, it's 19. But, you know, it was just something that you sort of did. And then when I was 5 or 6, I remember being taken by my parents in my pajamas at about 6 o'clock at night to the local town hall to get my Sabin vaccine. So I think this idea of something that's just very simple that can protect you for an entire lifetime is very exciting.
Yes, so far the data has been very good in that if you have your vaccination as a teenager, as a 13-year-old, it lasts for a lifetime. So that's what it's been shown. So there were many questions in the 10 years ago as, oh, how do you need a booster? So far there doesn't seem to be the need for a booster.
Excellent. Dear friends, it is just coming up for 1:15 and Prof. Woo has to leave us now. So I'm just going to say thank you so much, Prof. Woo, for your time and generosity and insights and generous sharing of information. I'm going to give you a little reaction, which is one of these.
Thank you. I hope if you write anything up in your own country that you would share with me. If anything else, if you write a piece in any of your countries represented here, maybe send me a copy, please.
How can people get in touch with you? I know you're horrifically busy, but if someone wrote a piece at the end of this, how would they let you know?
And I'll put it on my social media, we'll share it, you know, it's all about educating and getting the message out.
That is very kind. Thank you so much.
All right, then. All the best, everyone. Bye.
Bye, take care. Everyone else stay on the line. See you, Prof. Woo. Okay, so folks, we're going to take a short break, just a 5-minute break. And then when we come back together, we'll have a look at basics of covering science and then also a look at solutions journalism. So welcome back. I hope that you've had a nice break. So folks, what I'm going to do is go into the second segment of our class today. And for that, I'm going to share my screen. Just going to make sure that I share my sound. And I'm going to keep a very tight eye on the time, because what I want to do now is to look at how do we apply a solutions journalism lens to women's preventive care. So the first thing I wanted to talk about was a little bit about covering science and health as a generalist reporter. Just wonder if you don't mind, maybe pop into the chat box if you're a specialist journalist on science, or if you think that you are more of a general person. So would you say that you were a general person or a specialist science reporter? So you could go science journalist, or you could say general, like that. So do you want to just put those into the chat box? So Mylene is a general person. Hidai is a general. Yep, Joanne is general as well. Roshini works in science and medical journalism. That's great, Roshini. I think it might be Anthony. Is it Roshini Anthony or Anthony Roshini? It's Roshini. Okay. Excellent. So we've got so we've got some science journos and some science and health journos. Excellent. All right. Oh, and Alifa is also a science and health person. Okay, so just a general sample there. It's sort of 50-50 based on what I've got time to look at in the chat there. So for those of you who identify as a generalist reporter, think about science like any other specialist subject. So like sport or business or fashion or music, you know, they all come with their own kind of jargon. They come with their own language and concepts, but you can learn to cover science and health in the same way that you could learn to cover the music industry or business. And some of the things that you'll need is a contact book of experts and organizations, which is why it's so lovely that Prof. Woo put her contact information in the chat box. How good is that? But, you know, creating a contact book is going to really help you out. Another thing that's going to help you out is not just a willingness, but an enthusiasm to look up new words and concepts. So I worked as a science journalist for a few years for the BBC. I came from a generalist background. And the first time I saw science journal publications, it was quite confronting because the language is very technical and it was difficult to understand. So I got myself a thesaurus and a dictionary and a medical dictionary, a science dictionary. And of course, then when Google came along, that was a big help. But, you know, I was constantly looking up new words and concepts. And then a willingness to ask people, why is that the case? And what does that mean? You know, just at the beginning of that Q&A, I was asking Prof. Woo some fairly basic questions, but they're questions to which I didn't necessarily know the answer. And I think sometimes it works to your strength to be a generalist reporter, because you can say, well, I don't have a science degree. Help me out. How does that work? What does that mean? And then taking what you're hearing and turning that jargon into clear information. And if you can do those 4 things, then you can cover science and health effectively. Now, folks, I'm very interruptible in these sessions. So if you want to ask a question, I will just make sure I've got the chat open. So if you want to ask anything, just pop it in the chat box and I will be able to respond as we go along. Very comfortable with good old Zoom. Okay. So the way that science research works in a very basic sense is that someone who is doing scientific research will carry out an experiment, perhaps in a laboratory, or they'll survey a community or a population. They might do a study, for example, to look at the efficiency of a policy or the efficiency of approach, or they might do what's called a literature review. So they'll read everything that's been published on a topic and then publish a single paper saying this is what we know so far. So these are some forms of research work. When they finish that, they write up their results and they submit that to a journal. And if it's accepted by the journal, then the journal will put the article, the piece of work out for what's called peer review. And it means that people who are suitably qualified will look at the article and give feedback, and they may request quite a lot of changes. And once that's done and everyone's happy, so the peer review is satisfied that enough information is in that article and the data is clear, the language is clear, and it's accurate, then it's ready for publication. So that's the process. Now, a journal article is laid out very specifically. It will have at the very top who wrote it, listed in order from the person who made the biggest contribution to the paper down to the person who perhaps made the least contribution. So they weren't as involved as the person who's the lead author. Then there'll be an abstract, or perhaps it'll be called an executive summary that summarizes the paper. Then the question that's being looked at, the method that was followed, what was found, so the results, and then the conclusion. What does this mean? What further research is needed? And at the bottom, there'll be references, so the resources that are used by the authors. And so my tip is to read the abstract and the conclusion first. So the abstract says, this is the thing that we're looking at, and it sort of summarizes what we found. And at the end, it will be, what does this mean and what happens next? And the other top tip is to interview the lead author. Now, I wanted to show you the link actually that Prof. Woo shared in the chat earlier, which was this paper. So you can scroll back up and grab the link if you want to take a look at it. So this is the link that she shared about the impact of HPV vaccination and cervical screening on cervical cancer elimination. And it's looking at low income and lower middle income countries. Who is the lead author? Based on what I just told you, who's the lead author? If you look at this list. Maybe you can put your mic on or you can put it in the chat box. Maybe Roche, you're a science and medical journalist. Perhaps you could tell us who's the lead author on this piece.
It should be Mark Person.
Exactly, because he's listed first. There he is. And then there's a little 1 here. And if I click on that, that's going to show me where he works. And in fact, If you see the little hover over it, tells me what his email address is. So he is spectacularly easy to get hold of. Then if we go down, there's the abstract, the methods, the findings, and some data. And then if we go all the way to the bottom, there's the references. And it's a fairly straightforward piece, actually, this. So if we have a look here, interpretations suggest high HP vaccination coverage of girls can lead to cervical cancer elimination in most low to middle income countries by the end of the century. And we heard there that it's possible by the year 2030. There's lots of language in here that is difficult to understand, and it might take a little while to read, but just read it one sentence by sentence is another tip from me. So just go to here. So what does, independent, transmission dynamic models, I would need to perhaps look that up. What is a standardized base case scenario? I want to have a look at that. But just go through it slowly and it will make sense to you. Okay, so that's kind of what they look like. Now let's crack on. Oops. The reason that it's worth the effort, I found anyway, is that it helps us understand how things work. And you get to meet people like Prof. Woo who are super passionate about the work that they do. A lot of scientific research and health research in particular is trying to protect us from things and try to make the world a better place. And you get a real sense of that from covering science and health journalism. Hopefully some of us learned something new today about cervical cancer prevention. And we can then go off and write a story about that that empowers audiences to make informed decisions about their lives. And that's that moment where journalism really gets to shine because it gets to make a difference. And it brings us into contact with people who are trying to solve really big problems. How do we get rid of cancer? How do we reduce plastic pollution? How do we tackle climate change? Researchers are the people who are trying to fight those battles. They are often they may not have had training in speaking to the media, so they may not always be as articulate or clearly spoken as Prof. Woo. And so it sometimes means working with that person to say, well, but what does that mean? And can you explain it to me in, perhaps imagine that I'm, your mum, or I don't know, my mum, for example. Actually, my mum's a bad example because my mother was a psychiatric nurse, but just trying to explain it to someone, if I was your next door neighbour, how would you explain it to them? Just to help that person express it in terms that a lay person would be able to understand. Just keeping an eye on the time. Are there any questions? You guys are all happy? Keeping going? Okay. So I want to now introduce you to the concept of solutions journalism. And so has anyone heard of it before? Is it new to you guys? It's new to Mylene. It's new to Alphonsus. And it's new to Joanne. So it's new to a few people and to Alifa. Okay. So let's have a look at what it is. Okay. Solutions journalism is rigorous evidence-based reporting on responses to social problems. That's literally what it is. So instead of the story being about the people, it's about a response to a problem. That is the most important thing to think about when we think about solutions journalism. Now I'm just going to move you guys out of the way, but I'll keep the chat box live so I can see you if you ask a question. Solution stories need to have these 4 qualities. First of all, what is the response and how does it work? Right? It has to talk about what is the response. Second, it has to talk about, is there evidence that this response works? So if we were thinking about HPV testing, for example, the response is a new way of testing people for HPV compared to the pap smear. And how does it work? Prof. Woo was showing us how the little swab works and how you pop it into this little solution and you give it a bit of a shake and you send it off and it gets reviewed at a validated testing center. So she's talking about the evidence of it working. What are the insights, right? So what does the response actually, why does the response actually work or fail? So what do we learn about it? Would it work in my country, for example? Would it work in your country? So it may be that the HPV test kit that Prof. Woo showed us, maybe it's more readily available in Singapore than it is, for example, in, I don't know, Fiji. Maybe it, you know, in some countries, people are making it available for free. Perhaps in other countries, people have to pay. So what is the limitations of it, but also what are the insights around it? And then this final point here is, what are the limitations in my country? What are the contextual things that I need to think about, right? So could I bring this solution to my country? And if so, what would I need to keep in mind? What might be the barriers to making that work? So does that make sense to you guys? So what's the response and how does it work? Is there evidence that it works? What are the insights that I can draw from that? So could I make it work in my country or not? And what are the limitations? What's the cultural context, the economic context, and so on, that makes it clear what it actually is. So, and I'm very happy for you guys to perhaps take a screenshot of this, or maybe Jen, we can run this, just this one slide off as a, just as a screenshot to send off to people, as well as the recording. So what it isn't is hero worship, for example. So a story that focuses on the person is not a solution story. It needs to focus on the response, the solution. Theories and ideas, potential policies, potential spending, a new fund, etc. These are not solutions. These are potential solutions. So your story has to look at a real world response to a problem. And it can't just be happy stories, right? Climate change is not a happy story. Responses to climate change done in a way that is rigorous and evidence-based is what people need in order to provide them with sufficient information about the response to know, could we replicate that here? Would that work here? What might be the barriers to it working here? So here's a question for you guys. An organization in your city is helping to tackle infant mortality by creating a milk bank for nursing mums. Which one of the following is the solutions angle? Is it number one, a feature on a woman who has donated 700 litres of her own breast milk? Is it number two, a feature looking at how the milk bank works with data about its impact and information about cultural barriers to milk banking? Or is it number three, a story about a researcher studying the value of human milk banks? Which one of it is it? Is it 1, 2, or 3? Pop it in the chat box. So I'm going to ask Sharon, because I know your microphone worked because you spoke earlier, Sharon. Why do you think it's number 2?
It's actually focusing more on the response with evidence as well, including the data about its impact.
Thank you so much. And if I just ask Alifa, why is it not number 1?
It's focusing on an individual. So it's not focusing on solutions as much.
Excellent. Thank you so much. And Hidayah, why is it not number 3? You can just take a guess if you like.
I actually thought that was person focused and it's not really representative, and there doesn't seem to be any. It's about the researchers studying it, right? But no results. Like
exactly.
Yeah.
Yeah, exactly. Sorry, the line's not great, but I think you said it. There's not results. Exactly. It's not a real world response. It's about the potential value of something. It may be that you might talk to a woman who's donating milk to a milk bank as part of a solution story, and you might talk to a researcher studying the value of milk banks, but you would need to look at this as your primary angle. Is what is this thing? How does it work? What are the what are the cultural barriers to it? What are the limitations? Could it work somewhere else? Is it working in one place but not another place? And so on. So we don't do solution stories for every story. I think this is something that I've found since I did the solutions journalism training to train this sort of stuff. One of the things that I get asked a lot is, well, does this work for every story? Is this the kind of idea? And it's like, no. You know, it's not for breaking news stories. You may still want to do features about an individual. An investigative story may not necessarily be about a response. You might want to do profiles. And of course, we need to cover upcoming policies, upcoming plans. There's the anticipated budget spend next year on X. All of those kinds of stories are still absolutely important. But solution stories is where something's working in the community to tackle a problem. And you might find that an interviewee talks to you about responses to social issues, or you might ask them about it. You could go back to past stories that you've done or past interviewees that you've spoken to from stories that were about a problem and say, actually, have you seen anything that's tackling this problem that you think is working? And then you can start applying this principle here, rigorous evidence-based reporting on that problem, on that response to that problem, in order to be looking at whether or not you have a solution story. And I'm going to show you a couple of case studies, but I am also going to end this session or this part of the session with a link to a solution story tracker, which is a big database of solution story examples. Here's a couple of things that you can think about when you're doing a solution story. So you could do a compare and contrast. So here's a problem we have. Which countries or cities are doing this, are responding to this in an effective way? You could look at a change over time. So which places have managed to address this problem that used to be a problem, but now it's not so much, and here's how it was resolved. You could look at best practice. So who has interesting results in responding to this problem that we have? And, you know, would one of those work in this place? You could look at the beneficiaries. So which communities have seen real improvements due to a solution? Some of the things that might be interesting to look at is it cheaper to do, to respond to a problem in this way rather than that way, for example? So perhaps someone has reduced prices as part of a solution to a problem. You could look at efficacy of policies. So not what's a potential policy, but who's got this policy and how's it working? Is it working? And what are the limitations? And could we bring that here? And you can look at this through the lens of fairness and justice. So if you think about a marginalized community, for example, what is a response that at least does no harm and results in genuine benefits to that community? So these are some things that you could do instead of what we normally do as journalists, which is to say, well, this has happened and here's what this person thinks about it and here's what this person thinks about it. But it doesn't really offer much of an actionable response to that problem or this thing that's just happened. I will show you some links to a couple of things. Is it this one? Yep. So a couple of case studies. These are all from the Solutions Journalism Tracker, which we will share a link with you to at the end. So for example, long form text stories. This one is looking at reducing pregnancy-related deaths in Cameroon. And if I start to scroll down, you'll see on the right-hand side that this is a long read, right? So it's multimedia, but it's also a lot of text. So a standard long read text story. It can make people feel a bit sick if I scroll all the way through. So I will just show you the landing page for that. And I will strongly encourage you to have a look at these links later on. You can do shorter form text stories. So this one here is from the Bristol Cable, and it's looking at economic recovery to coronavirus in the city of Bristol in the United Kingdom. And this is a much shorter story, so it's about 800 words. But you can see Bristolians are self-organising a phenomenal coronavirus fight back in ways that will outlast the pandemic. So I would expect to find here a description of what they're doing, an explanation as to how it works and some evidence to show why it's working. I would want to understand the insights from this piece, right? So what are the cultural contexts that allow this to work in Bristol? Would it work somewhere else? And I also want to understand the limitations. So what's not working, or what are future areas for improvement? Where is this organisation or movement in Bristol going to go next? There are also video examples. I have shared the audio for this call, so I'm going to just play you this short package. This is a really interesting piece from Al Jazeera in the United States. It's very American in style, which means that it's the script is read quite quickly, so you do have to focus, but it's about a response to a common problem in the States, which is a high rate of reoffending among people who have been in prison at least once. So let's just have a look at this. And one of the other reasons I want to share it, apart from the fact that it's a video, it's also from a sort of TV style of video. And people often say, oh, you can only do solution stories if it's long form text. Well, let's have a look at whether we think they've done a good job on a video.
As the second whitest state in the US, Maine is not renowned for its ethnic diversity. Yet here amongst the New England clapboard buildings,
We'll use the talking piece.
a program is underway rooted in global indigenous cultures. It asks fundamental questions about the nature and purpose of criminal justice in the US. Prisoners are being released early so that they can learn from their crimes.
It hurts their family, it hurts, their surroundings, such as the community.
The key is talking within a circle.
There are kind of 5 keystone questions that we think about. What happened? What were folks thinking at the time or feeling at the time of that incident? What have they been thinking or feeling related to it since it's taken place? Who has been affected and in what ways have they been affected? And what needs to be done to make things as right as possible?
I was feeling anxious.
Juvenile offenders in Maine can escape incarceration altogether if their victim is prepared to seek redress through restorative justice instead of prison.
There are too many people in prison and that they're too young.
Like Charlotte, a gallery owner who chose to confront the 2 boys who robbed her to make them understand why what they did was wrong instead of having their lives potentially ruined irrevocably by jail time.
I just had the feeling that the kids who had done that had never really felt connected with the community.
Restorative justice began to catch on in the US as incarceration levels reached record numbers and the damage to communities was recognized. In some states, modern US law enforcement is looking to Aboriginal tradition.
It was in their best interest to bring them to the center and say, gosh, you have really erred here, you have really messed up, and we've got to figure out a way for you to learn from your misbehavior, to make it up to the people that you've harmed, and to return to being a functional, productive member of our community.
I go to school right over there.
Giff Campbell would still be locked up in a juvenile facility had it not been for Maine's restorative justice program.
It was like they were setting the kids up for failure rather than setting them up for success.
Giff broke into and vandalized a house when he was 12 years old. He's since worked for the homeowners and paid them restitution.
The first meeting was really emotional because he was telling us how much damage we caused.
Giff is returning to school soon. He's clear about his goal.
Wait, it's on your arm? Yeah, I just got that tattooed the other day, actually.
And those like Giff who make amends this way are less likely to reoffend, and almost all those offended against feel justice has been served. Shihab Ratansi, Al Jazeera, Maine.
Excellent. So that's a video example there. I won't show you all of these today because we're sort of heading towards the end of the session. I want to make sure that we finish on time. But I'll play you about 30 seconds of this piece here and you'll see it's a case study from social media, which is from the BBC News, and it's looking at plastic waste.
The world have the problem with plastic. Here in Norway, we think we have the solution.
So you can see the data that's happening there. Explanation of how it works.
Most places, an empty bottle like this would just be thrown in the bin or maybe even chucked on the street, but not here in Norway. I've come back inside the shop and this machine is going to reward me for bringing my bottle back.
So it's giving you that bit of extra information.
Or something, we pay 1 kroner extra, and when we put it in the machine, we get that money back again. And it's really easy because you recycle and it's good for the environment.
A bottle can be recycled more than one time. It can actually be recycled 12 times. We separate the clear bottle from the color bottle. The clear can be used in new bottles. The color bottle can be used in new plastic material.
So just there you can see that that's the limitation. So it may not work so well in a country where perhaps drinks companies aren't interested in recycling. And also it's a voluntary program in Norway. And there's obviously been some effort to get people to buy into this idea and support it.
If soft drink producer join our system, they pay less taxes. Everyone wins.
So it's short, very, very short and sweet project there from Norway. So hopefully you're starting to get the idea of what is the response and how it works. Is there some data to show evidence of it working? What are the insights that someone would take away? Is there enough information that they might be able to replicate it where they live? And also, what are the limitations? What would make that straightforward or perhaps a little bit difficult? I'm just looking in the chat. I can see, yep, excellent. That's just a comment from Jen. I also wanted to show you a still image concept here. This is from an organization called Plastic Soup. And I have to say quite a lot of solutions storytelling, and when you look at solutions science stories, are about plastic. But I think that's partly because there's been so much attention on plastic waste, and also there's been a lot of funding for journalism about this. So it'd be great to see something around cervical cancer. But as you can see here, this organization is doing a series of Instagram posts. So it's not just one, it's a bunch. And then of course, the new look Instagram, if I swipe this, I can learn a little bit more. So it's quite rigorous. So we monitored the waste in Dutch rivers last fall. So that's last autumn. This is what we found. Coca-Cola aims to make at least 25% of its bottles refillable. Here's 5 reasons why we're skeptical. Okay. Just another 2 more quick examples. One is a podcast. It's literally a podcast about solutions journalism stories. So that's one to subscribe to. And this, I'm going to finish with this because I think it's one of the most extraordinary pieces of animation that I've seen in a long time, which is how favelas, which is the slums in Brazil, it's a word for slum or, you know, ad hoc housing in Brazil, how people responding to COVID in those communities. And if I just scroll through this, you'll see that it's an animation like that. And it's optimized not just for desktop. You're seeing this on my laptop, but you can also see it as a mobile first piece of storytelling. So it's really nice. And this was produced with external funding. So sometimes there's external funding that's available for this sort of thing, which brings me to the Solution Story Tracker. So this is a place where you can search for stories. There's a large database here, and also you can submit a story. So if you write a story that takes this approach to journalism, rigorous evidence-based reporting about social problems, you can submit it here. And that means it also joins this wonderful database where you can start to search. So if I look for women, then I can look for women's rights. And this is going to tell me there's 320 stories on the tracker there that I could look at for ideas and inspiration. Excellent, of course, wonderful. Okay, so I'm just going to wrap up, I think, head on down to my, towards the end of my slides here. Guys, do you have any questions about solutions journalism to start off with? Is there anything that I've mentioned that wasn't clear to you? I've just realized that my camera was off that whole time. Does anyone have any questions? Excellent. All right. So thinking about this, what we've heard today with regard to cervical cancer prevention, and the 21, I think there were 21 ideas that I put into the chat box during your reporting back from Prof. Woo and her presentation, and then your breakout groups. Can you think of a solution in your country or an angle that might work on one of those story ideas that would take a solutions approach? I think one of the questions that jumped out at me, an angle, was what is the state of reliable test kits in my country? So that point that Prof. Woo mentioned, that as long as, you know, Sharon, I think you asked the question, are they as accurate as a pap smear? Was that you that asked that question?
Yep.
Yeah. So I suppose that's a question then is, all right, well, if I've got notification from my doctor that actually I can now use a sort of equivalent to a PCR test instead of a pap smear, fantastic. But what, you know, where are the kits coming from? So that's a solutions angle is there's a new way of testing for cervical cancer. And then a way of looking at that is to say, what does it look like, right? But one of the questions you might explore in a solutions story is that limitations element. Are we importing good quality tests from reliable companies? And also, you know, is the machinery that's doing the testing, reviewing the tests and making, you know, sort of assessing the, what do you call it? I wish I knew the word for this. You know, the solution in the little thing that goes in the machine. Is the machine, you know, is it a validated machine? She mentioned a validated machine. So that was one. Any others? Hidayah.
Looking at so I mean, in Singapore, there have been several free vaccination drives. Maybe we can look at the impact of those drives. At this point, has it kind of alleviated the rate of cervical cancer? Yeah.
Maybe that would be a compare and contrast opportunity, Hidayah. So you've got vaccination drives happening where you are. How does that compare to the efficacy of other vaccination drives in other cities or other countries? And what is it about the way that those are done that makes it work in one place perhaps better than it works in another? That might be a way of doing it. Yep. I'm just looking back through the story ideas that you guys mentioned earlier. So one of them was the willingness of governments to supply vaccines and how to tackle HPV vaccine hesitancy. That was from group 1. I'm trying to remember whose idea that was. Do you guys remember? So a solution story angle on that might be to look at which countries have got processes in place to tackle hesitancy around HPV vaccination and what's working, why is it working, and would it work where we live? If so, why? If not, why? How does that compare to the solutions that are being implemented where we live, for example? Do you guys feel that there's vaccine hesitancy, or there might be vaccine hesitancy in your countries around HPV? Yes, no?
Yes.
And why do you think that would be, Hidayah?
Well, one thing is the stigma I mentioned. Just HPV, it's not something that people upon everyday conversation will talk about cancer, but they won't talk about the virus. That could be a lack of knowledge or awareness. Talking about HPV in public and how similar it sounds to HIV is also another thing I'm quite sure, especially with the older generations. One. And number 2, definitely the heat. Someone mentioned earlier about, you know, we are already having COVID vaccines. I think even before this, you know, you had flu vaccine, you had checkup, you had to do mammograms and all that. So people didn't want one more thing to add to their roster.
Okay. So something to just keep in mind. Do you remember I mentioned that not every story is going to be a solution story? So some of that might actually be just a straightforward feature on vaccine hesitancy in relation to HPV vaccine, but that will naturally point you towards people who are tackling that hesitancy, and it will naturally point you towards who's doing a better job of it in terms of the data that they're getting. Are they finding that as a result of the way that they're approaching that, are they getting a higher level of you know, a higher number of people going out and getting vaccinated, or a greater willingness to you know, have their daughters vaccinated when they're sort of 13, 14 years old? That would be interesting to look at. Awesome. Okay, well, I think if that's okay with you guys, because we are coming up for the close of the session, and we did want to hear a little bit, I think, from Patricia at Roche. So Jen, are you happy to take over the reins as we sort of head towards the end? Do you need me to share my screen?
Yes, please, Corinne. We can share the screen and welcome Patricia from Roche to give us announcements regarding our
Jen, we can barely hear you, but Patricia, you're with us as well, aren't you? Do you mind popping your camera and microphone on?
Yes, can you hear me?
Oh, yes, loud and clear.
Loud?
Excellent. Excellent. So Patricia, Patricia, if you wouldn't mind just reminding us that I know we mentioned, we did the introductions to everybody at the end, but if you could just remind folks your sort of title and the role that you at Roche have had in this workshop, and then I'll share my screen with the upcoming event that you're going to talk about. Just give me one sec.
Yeah, sure. Thanks, Corinne. And first of all, apologies to everyone. I have to keep my camera off because my internet connection keeps going on and off throughout the masterclass. But just a quick intro from my end. My name is Patricia, and I work for the regional communications team at Roche Diagnostics Asia Pacific. And over the past 2-3 years, we've been working closely and very wonderfully with WAN-IFRA to organize these masterclasses, and also what you see on the screen here, which is the Diagram Media Forum. So really in partnership with WAN-IFRA and Jen, we're organizing this masterclass to, give everybody an insight into, and also bringing you people like Prof. Woo, who is such a wonderful speaker and a strong patient advocate for cervical cancer screening. But then also here on the screen, we have the Diagram Media Forum, which is coming up on the 16th of March. And this media forum essentially is a platform that we try to organize twice a year. And it is to connect journalists like yourselves with key opinion leaders from the healthcare industry, like Prof. Woo, but also like the people that you see on the screen. So for the upcoming media forum happening on the 16th, we have our healthcare professionals and leaders in the industry from Pakistan, Taiwan, and regional voices like Rohit Sagal, who comes from a think tank in Asia Pacific, and also Dr. Sankar Narayan, who is based in India, but who is also a visiting scientist for the World Health Organization. And the aim of this media forum really is to connect journalists with key opinion leaders to essentially have a conversation like what you've had with Prof. Woo earlier in this masterclass, but to have a deeper dive into a specific topic. And for the topic on the 16th, we want to focus on what needs to happen to make our healthcare systems in Asia Pacific move from a reactive system, which is what we have today, to a proactive and preventative one, which is also akin to what Prof. Woo was talking about, and the value of screening and how it can help save lives if our healthcare systems are equipped for that. So that's the topic of conversation on the 16th, and you can scan the QR code on the screen to register, but I'll also just pop the registration link in our chat function here. There's no fee. It is a completely, you just have to sign up and dial in essentially on the 16th to attend the event. And there will be 2 panels. So the first panel would be Dr. Bushra, Rohit, and Prof. Young. And the second panel will be Lance Little, which is the managing director for Roche Diagnostics, and Dr. Sankar. And the entire session will be moderated by Salma Khalid as well. Thank you, Jen, for popping the link into the media forum.
That's wonderful, Pat. That's wonderful.
Thanks,
thank you. Oh, thank you so much. And guys, just a quick thing. Jen is going to send you all a handout, which consists of a whole bunch of things that I came across when I was putting together this session, and also some wonderful resources from WAN-IFRA and from Roche. And Jen, I think maybe if you can also add the link to the media forum at the end of that before you send it out, that would be terrific. And also you'll see all of the links for today including some that I didn't get to, will be in that handout. So I do try and keep these things to just one page, but it's a very rich and yummy page, which I hope that you guys enjoy and find useful in supporting your journalism, you know, in this sort of broad sense, but also in specifically on the topic of today's session, which has been looking, as we know, at preventing cervical cancer and gynecological cancers in the Asia Pacific. I'm going to wrap up, but guys, thank you so much for joining us today. Stay safe, stay well, and thank you for your time and attention this last couple of hours. All the very best.
Thank you, Corinne.
Thanks, Pat. Thanks, Alphonsus. Thanks, Roshini. Thank you all. Take care.